You know, I love to bowl. You tell me we're going bowling, and I'm there.
Yeah, you're pretty good at it, too.
Yeah, I'm not bad. 161 average. Pretty good.
And the same holds true for Stephanie Reitz. She's a spokesperson for UConn who actually took up the sport of bowling about 5 years ago.
Yeah, she's getting pretty good, but pain in her fingers was preventing her from really enjoying the sport, so she turned to the doctors at UConn for help, and they delivered. Take a look.
I'd like you to meet Stephanie Reitz. She's a university spokesperson at UConn. Stephanie has been typing for years, starting as a young teenager.
I started typing a lot when I was 13 because I was one of those angsty teenagers that decided to keep my diary by typing. So I would sit there and just type out all of, every drama that a 14-year-old girl goes through, page upon page. And those were not great typewriters anyway. So probably didn't help my fingers. But, when you're a teenager, you don't think about that. And then 20 plus years of typing every day as a news reporter. And now in my communications job, I type every day because I'm doing emails, I'm doing stories. I really didn't think about my fingers, though, because that seemed to me something to be worried about maybe in my 70s or my 80s.
Sure.
So at 50, I expected that things would start to kind of fall apart a little bit at 50 and I'd become like potato-shaped and all the other things they tell you will happen, but I never thought I would get any sort of arthritis or finger issues.
But she did, diagnosed with osteoarthritis in her fingers by Dr. Joel Ferreira, an associate professor of orthopedic surgery and hand surgery at UConn Health in Farmington.
So there's basically two types of arthritis. There's wear and tear, which is osteoarthritis, and then there's the inflammatory type, rheumatoid arthritis, where the body kind of attacks itself. That wasn't this. This was the normal wear and tear arthritis.
Okay, and so Stephanie came to you in pain, and you took, what did you do?
Yeah, so we talked about different options of things, It's very limited with how tiny this joint is and kind of conservative things we can do. Sometimes we can try like oral medications, anti-inflammatories like Advil, ibuprofen. A little bit more invasive, you could consider like a topical cream that can be due if patients can't take anti-inflammatories, because a lot of those anti-inflammatories can cause issues with acid reflux, heartburn, that kind of thing. Unfortunately, in other bigger joints, you can try cortisone injections, other types of things to decrease the inflammation. With this joint being so tiny, unfortunately, the only other thing we could actually offer her was surgery.
Dr. Ferreira showed her the x-ray.
And he showed me, he said, your cartilage is gone. It's jelly. It's absolutely ruined, and your bone is rubbing against your bone.
Stephanie had the surgery, and all was good with her finger. Then she took up bowling.
And then in 2021, some parents in my son's bowling league asked me to join their team. And I said, well, I'm terrible, but if you want me, that would be great. Sure, thanks for asking. And I joined, and I had a lot of fun with it. But I noticed as time went by, my finger was getting stuck in the hole. And as I would bowl, the ball would get stuck, and then it would loft off and land on the lane, and, terrible scores. And and I would complain about it. And
the same finger that you had up?
Actually, no, that there was the middle finger on the same hand, and these fingers too. Basically, all four of the fingers at this point were starting to be painful.
The arthritis had moved into her other fingers, and bowling was becoming less of a ball for Stephanie.
Anybody who's bowled will tell you that there's a million excuses that people give as to why they're not hitting a strike. And
100%.
It's usually the lane conditions or the ball or the approach or noise or the fan or solar flares, whatever. But at some point I was like, I need to not be complaining continuously about my finger getting stuck on the ball. And it was hurting. It was honestly hurting. There would be times when I would be bowling and I would load up on Advil just because I thought, well, I want to do this. I want to participate with my team, but this is going to be a problem with this finger. I had to continually get the ball hole drilled out a little bit more because the knuckle was getting bigger and bigger. Fortunately, I have a fantastic ball guy, which you get when you're in bowling, I found out. And he was very patient and, worked with me for the best grip and the best hole. And it got to the point I thought, Dr. Ferreira was so great with this finger, I really should just go ahead and take care of the other ones because they're certainly not going to get any better.
The surgery was scheduled around Stephanie's bowling schedule. Yes, Stephanie started bowling a lot.
Pound ball,
How often do you bowl a week?
The 2 leagues, plus I usually practice once or twice a week, so we bowl a lot. And then we go to a lot of tournaments. I was in a tournament last weekend. I'm in a tournament this weekend. Spring is all tournament season. Like, my poor friends, they'll say, do you want to go out for coffee? I'm like, I got a tournament, I got a tournament, I got a tournament.
The surgery was a complete success.
To take the 2 bones, scrape the little bit of the joint that is still there, and make it one bone and hold it in place with a screw that stays inside the bones.
And that's what you did with Stephanie.
That's what I did for her, yes.
And her remarkable outcome. I mean, you got to be.
She's done fantastic, yes. And I will say that patients that do have a lot of pain with this, they do exceptionally well with the surgery and getting rid of the pain from it. Always my concern, and we talked, in depth before we did this surgery, was that I always question how much function will she lose in terms of her bowling, but she's actually done incredible.
200.
Yeah.
That's right, Stephanie with her new fingers just bowled a 200 game.
I finally hit my first 200 game after the surgery.
That's exciting.
That was exciting. I bought myself a little 200 ring off of Etsy, which is not really a thing, but I'm going to make it a thing.
Good for you.
If you're having trouble with your hands, wrists, or elbows, you might want to call Dr. Ferreira at UConn Health in Farmington.
I came here for my training, and I was fortunate enough to get hired to come back, and I have a great hand center here at UConn where I have 2 fantastic partners. I've known both of them for over 10, 12 years, and we're just a big team together.
And people just shouldn't have to live in pain.
Should not have to live in pain. And if there's any issues with the hands, we're always more than happy to see it here at UConn, or any body part, because all of my partners here are willing to help anybody in pain from orthopedics, yes.
Okay. Well, I'd like to give you a hand. And here you go. Thank you, doctor. It was a pleasure to meet you.
Pleasure to meet you, too.
Thank you.
You are so juvenile. I love
I know, it's so funny. If you would like to learn more about UConn Health, or you want to make an appointment, please visit health.uconn.edu.
Stephanie has a better score than you do at
She
bowling.
did 200. I was like, what is going on?
Yeah.
So good for her.
Okay.